Clear vision is an important part of life, and people with unclear vision have to cope with the everyday annoyances of wearing glasses and using contact lenses. It's time to discover LASIK and change your view about everything you see, about how you feel about yourself and your quality of life. Let's find out how LASIK can help you. LASIK, or laser in situ keratomileusis, utilizes state-of-the-art laser technology to correct refractive errors associated with nearsightedness, farsightedness, and astigmatism. A large percentage of the nation has at least one of these. Refractive errors were originally corrected with a surgical procedure known as RK or radial keratotomy. With RK, small incisions were made in the cornea. But ophthalmologists discovered in the early 90s that the IBM excimer laser, originally developed to etch computer chips, could accurately and precisely reshape the cornea to correct refractive errors. The beam is so precise, it takes 200 pulses to cut through a single eyelash. The excimer laser produces a cool beam of light that does not damage surrounding tissue. It was first used in photorefractive keratectomy, or PRK. PRK treats the front surface of the cornea, while LASIK alters the inner tissue of the cornea. The excimer laser and LASIK are approved for refractive surgery by the Federal Drug Administration. LASIK is the preferred treatment for laser vision correction. During the LASIK procedure, a microkeratome makes an incision in the corneal cap. Dr. Holladay lifts the flap, then directs the beam to gently reshape the cornea. The procedure usually takes less than 60 seconds per eye. Dr. Holladay lays the corneal flap back into its original position, and healing begins. No stitches are required. Most people can see well the very next day without glasses or contact lenses and resume normal activities. LASIK creates clear, unaided vision. Clear vision occurs when light rays pass through the cornea, pupil, and lens to focus clearly on the retina. With refractive errors such as nearsightedness, farsightedness, and astigmatism, the image on the retina is blurred. Nearsightedness, or myopia, occurs when the cornea is too curved or the eye is too long. This causes light to focus in front of the retina, resulting in blurry distance vision. Farsightedness, or hyperopia, occurs when the cornea of the eye is too short. This causes light to focus behind the retina. The result is blurry close vision more at near than distance. Astigmatism occurs when the eye is irregularly shaped. This causes light to focus on more than one point on the retina, resulting in blurry, distorted vision. The LASIK procedure corrects any one or a combination of these refractive errors. A board-certified ophthalmologist for 20 years, Dr. Jack Holladay helped pioneer LASIK. He is recognized as an international lecturer, author, and award-winning surgeon, exclusively specializing in LASIK. He serves as Secretary of Education for the International Society of Refractive Surgery and is a professor at Baylor College of Medicine in Houston. And Dr. Holladay created the software used in machines that measure the shape and thickness of the cornea.
Perfection is the thing that you have to strive for in this, from the preoperative visits through the operation and through the postoperative visits. So we really do emphasize the quality of our outcomes because we're so meticulous about the quality of our measurements and how we work patients up. For example, not only your glasses prescription, which obviously we need to know the power of your eye and what your glasses are, so we always do that twice, and not only do we measure it twice, we actually do it when you're dilated and not dilated, so that those measurements get all double checked so we know exactly what your prescription is. But the next thing that we need to know is the shape of your cornea. Today, there's actually some newer instruments that we've helped develop, like the OrbScan technology that gives you tomography, the ISIS topographer that gives you a map of the surface similar to a mountain or something like that. We've measured the cornea now, we've measured the glasses, but your pupil size, for those of you who've heard about halos or glare at night, it's not a mystery. We know exactly why those happen, and it boils down to this. If your pupil, the dark part of your eye, is larger than the treatment zone that we make, then you're going to have light coming through the part that we've treated and light around it, and that causes halos and glare. So on every single patient that we see, we use what's called a Covard pupilometer that measures the size of the pupil down to about 1/10 of a millimeter. We can predict the patients that would see halos and explain to those that won't that they won't have them, and then talk to the ones that may have halos, and if they're going to have them, if they say, boy, that's something that I don't want, then you don't do the procedure. When you get to the laser center and come in, the first thing we do is usually give you a little relaxing medicine like Valium. And it's just to take the edge off. So then we bring you into the pre-op area, and in there they clean around your eyes just to make sure there's no bacteria. And then after all that's been cleaned, we bring you into the laser room, lie you back, and then swing you under the laser, put a few little anesthetic drops in there so you don't feel anything. And then there's this little blinking red light in the microscope that you look at. I then look through the microscope down at your eye to make sure that everything's lined up just right. We then make the flap with the keratome, and we do the laser procedure, and the patient's only job is to look at that little blinking red light. And if they drift off a little bit, it's like a video game, and I follow them around, but it's obviously easier with them just looking at the light and not drifting. But the reassurance is there's nothing the patient can do to mess up the procedure, because if they look away, then I stop, line back up, and go on our way. That whole laser treatment usually lasts, for most prescriptions, less than 60 seconds, and for both eyes. And then after that whole procedure with the laser, we take you out of the room, we walk you back into this little post-op room, and then we lie you back in a chair at about a 10-degree angle looking up at the ceiling, because we found that gravity working this way on your eyes and blinking helps make that flap even better within a few minutes. You're there for 15 minutes while we put drops in, and then we put these little bitty clear plastic shields over your eyes, and you go home. And you're already seeing better that afternoon, but the real wow is after you go to bed that night, and when you get up the next morning, you'll be seeing well enough to drive in with no glasses, and most people are in the 20/30 range on that very first morning, no matter how large their prescription was.
I wish I hadn't put off doing this so long. I mean, I wish I'd done it a few years back. I'm really glad I did it.
One of the things that LASIK cannot do is a problem with something that's called presbyopia. Now, presbyopia is a great big word for what means this. When you get over age 40, your arms get too short and you can't read things, so you have to hold them way out here or you put them on the table. That's called presbyopia, and that has nothing to do with what we've been talking about, because your distance vision is real good, but as we get older, the lens in our eye gets harder and the muscle can't change the shape. So when we're about 5 years old, we can see here. When you're 40, it's about right there, and past 40, your arms are too short. Well, laser vision doesn't help that. One thing that we really pride ourselves in is the ability for the patients to always have access to me. When you come in for your first visit for a consultation where we try to determine whether you're a candidate or not, you talk to me, we go over all of your findings and your measurements, and we find out if you're a good candidate.
Many insurance companies consider LASIK an elective procedure, but more and more are starting to cover it. Like other outpatient procedures, there are other charges for the facility where the laser is utilized, medications, and the surgeon's fee. Dr. Holladay provides extensive pre-surgery eye measurements worth hundreds of dollars and a 5-year guarantee. Excellent financing plans including competitive fixed interest rates and terms to 5 years are available. Options can be determined during your free consultation. According to U.S. News and World Report, the quality of your surgeon's expertise is the most critical factor in one's LASIK surgery. Even Dr. Holladay's own employees have trusted him with their LASIK.
He's never had one person and all the patients he's done that didn't have perfect vision for driving. And pre-operatively, I was about 2400, which means I couldn't even see the big E. And post-op the next day, I was seeing 20/15, which is better than perfect.
20/40 vision without glasses is good. It means you can drive with no glasses and stuff. And in the thousands of cases that we've done, we also have recognized that there are little differences in the age of the patient in terms of how fast you get well, but everybody has somewhere between 20/30 and 20/50 vision on day one, and by the end of a week, the vision usually zooms in to right what we expect it to be.